Alright, so we are going to go over the bones and bone marking list for the axial skeleton. I'll cover most of the structures, but some of them are just easier if you just look at pictures, just because I can't really show you with the drawing tool on here. So we'll start up at the top in the cranium for the sutures. So first one we're looking at here is the sagittal suture. That is this wiggly one over here on the sagittal plane. The next one is the coronal suture on the crown of your head. The next one we'll look at is the squamous suture, which is the swan on this side. And then the last suture is on the posterior aspect, called the lambdoidal suture. Got its name from the Greek letter lambda. If you've taken some math courses, you may have seen it. It looks similar to an upside down Y. Okay, so our next section is just the bones and the bone markings. So we'll start up at the front here. So you have the frontal bone. We've got two structures that we want to look at on this frontal bone. We'll zoom in a little bit. So if you break down these words, they tell you exactly what they are. So the supraorbital foramina is above the eye, and it is a foramen or foramina, so a small hole. So is that dot right there. The next one is the supraorbital margin. So once again, above the eye, and it's the margin. It's just on the edge here. Okay. There is no structures on the parietal bones, which are right here. We'll look at the temporal bone. Got quite a few here. So the first one we're going to look at is the external auditory meatus. So that's right where your ear is. It's this structure right here. The mastoid process is this big bump on the back. The styloid process is the pointy one. I don't think they're as pointy on the models at school, but if you just go anterior to the mastoid process, you should be able to find it. So the zygomatic process of the temporal bone. So once again, this right here is the temporal bone. This over here is the zygomatic bone. So the zygomatic process of the temporal bone would be this section right here. This next one is the stylomastoid foramen. So once again, let the words kind of tell you where to look. Got the mastoid process on this side here. And we've got that pointy styloid process. So if you look right in the middle, you'll have this foramen. And that would be the stylomastoid foramen. This next piece is the mandibular fossa. So this is the mandible. So if we were to hide that structure, this spot right here, right where that bone articulates, would be the mandibular fossa. Bring back the jawbone. Okay. The foramen inside of the skull are just easier if you were to find a picture. I can show you kind of the issue when I look at this. So the foramen lacerum would be this hole here. And see, it gets kind of difficult to really see what's going on in that aspect. So I would encourage you to find a nice picture on the internet, and then when it comes exam time, make sure to orient yourself to make sure that you know if you're looking into the skull, if you're looking at the bottom of the skull. That way you can remember one set of foramen and not, two. So we'll get back to where we're going. So if we look at the occipital region, there's not much back here. So you have the foramen magnum which is at the bottom here. If we get rid of the atlas, you can see that hole. Foramen means hole, magnum means big. That would be that structure right there. The external occipital protuberance is that bump on the back of the head. If you reach back there, you can feel it on yourself. The hypoglossal foramina, that would be, these structures right here. Those are the hypoglossal foramina. And then the occipital condyles are where that vertebrae, the atlas, articulates with the skull. Okay, clear that out. So we'll look at the sphenoid. Once again, it's kind of hard to get all of the foramen and differentiate them through this app for me to show you. So I'd once again encourage you to get a picture online, but I can show you the big ones. So the superior orbital fissure and the inferior orbital fissure. Inferior and superior. Okay. We'll return here. The ethmoid, you would be able to find all of those on a picture. We can look into it a little bit here, but once again, I would encourage you to find a picture. So this is kind of what you'll be looking at. It'll look different on your picture, but this bone is the ethmoid. The perpendicular plate you can see from an anterior view. Just look into the nose, and it is this section right here. The cribriform plates and cristagalli and the olfactory foramina are all right in here. The cristagalli is here. The olfactory foramina are the little dots. The cribriform plate is what all of these structures are on. Okay. We'll move on to some of the bigger structures in the facial bones. So we'll zoom back in. Okay, so this is the mandible, your jawbone. The ramus is the upper part. Body is down here. The coronoid process, and it's important that it's a coronoid and not coracoid. The coronoid process is up in here. The mental foramen are the dots on the bottom there. Right there. And there's one over there. Okay. The maxilla is one of the big bones of the face up front next to your nose. The palatine process is inside of the mouth. Once again, pretty hard to identify in here, but a picture would do fine, and the models are a help when you get into lab. The lacrimal bones, that is the lacrimal bone right there, and that dot, or that hole, right in here, is the lacrimal fossa. That's where your tears come from. The zygomatic bone is there. It's the big cheekbone. You've got your nasal bones, the bridge of your nose. The vomer is, vomer is that big, very thin structure don't get that confused with that perpendicular plate of the ethmoid. So the perpendicular plate of the ethmoid is superior to the vomer. The hyoid bone is an interesting bone. It's free floating, doesn't articulate with anything. It looks kind of funny when you see it this way. The orbit is the eye sockets and the nasal cavity we have there. All right, so we have a thoracic vertebrae here. We'll look at some of the general structures that you'll need to know. So if you orient yourself so that the spinous process is posterior, you have the body. The pedicle is like the attachment point. The lamina is the face of this vertebrae. The spinous process is the pointiest part. This is the part that you can feel. If you were to press on someone's back, you feel those points. The transverse process on both sides there. You have the superior articular facet there, or facet, whichever one you prefer. The inferior articular facet is back here. The intervertebral foramina is formed when you have multiple of vertebrae. So right now you can't really see it. And then the vertebral foramina is where that spinal cord goes. So it's right in the middle, protected by the bone. Okay. So if we were to look at a different vertebrae, so let's look at a cervical vertebrae. We'll pick this one. So if we hide the others, perfect. Okay, it looks a little different. One way that you can tell this is a cervical vertebrae is because of these transverse foramen. This is where your vertebral artery goes. If you looked in the thoracic vertebrae, they are not present. There are two special cervical vertebrae, the atlas and the axis. The atlas is the first one. The way you can remember that is the weight of the world is on his shoulders. So it's like a Greek god, or a Greek story. I'm not quite sure, but this would be the atlas. Once again, looks a little different, but it's easily identifiable without the spinous process. The next unique cervical vertebrae is the axis, so that's the second one. This one is pretty easily identifiable because of the dens, or the odontoid process, which is that piece up there. Once again, you can see the transverse foramen out on these sides, and then this is the vertebral foramen. Now, if we look at a lumbar vertebrae, it'll look different, pretty different compared to the other ones. This one kind of looks like a moose, if you want to remember that. The thoracic ones look kind of like a giraffe, if that helps you out. So, once again, we'll go through these structures again. The body, the pedicle, you have your superior articular facet, your inferior articular facet is down there, and if we rotate, the spinous process is here, and that is the lamina. the last two pieces of the vertebral column that you need to know about. You have the sacrum and you have the coccyx. And it does not look like you need to know any structures on those two. So just being able to identify the sacrum being at the low part of the back and the coccyx down here. The last bit of this sheet is the thorax. So we have the sternum. So this section is the sternum. The manubrium is this top piece. The sternal angle is down here. The jugular notch is that middle piece. The body of the manubrium is this long piece. And the xiphoid process is this little spot down here. Okay. Now, if we look at a rib, there's not really a whole lot of what you need to know on the rib, but what you will need to know is rights and lefts. The best way I can say to help you learn that is you just need to hold on to one and see where it articulates, because these pieces, oh, it's not working. There we go. These two pieces up here articulate with the vertebrae in the back. And then if you'll see it when you go into lab, but the inferior aspect of this is kind of pointed and the top is kind of rounded. So always remember to point down and have the articulation points going towards the back. So some pieces that you need to know: the head of the rib is here. The costal angle is where it starts to turn, and then the body. True ribs, so you can see if we get the body back here, I'll add some connective tissue. So true ribs have one piece of this costal cartilage. False ribs are connected through this junction. If we can highlight that a little bit. Highlight through this junction here. And then floating ribs are the ones that do not have any cartilage connecting to the sternum. So that would be down here.